Hi, I'm Larry Gifford, and I have Parkinson's disease.
So Christmas Day, we found out that I was pregnant.
Wow, that's awesome. And then how did the pregnancy go with Parkinson's?
The pregnancy was really difficult.
This is When Life Gives You Parkinson's. Joining me today is my partner in life and in Parkinson's, Rebecca Gifford.
Hello. It's always good to be here. This episode is about women with Parkinson's. This is a population that is diagnosed less often, less accurately, and offered treatments that are less effective, often because hormonal cycles play a role. This is an area that's still rather unexplored regarding Parkinson's disease.
We're going to hear from 3 women with Parkinson's who also experienced pregnancy, giving birth, and parenting with PD. All their experiences were different, but certainly complicated by their Parkinson's. And all 3 took years to come to grips with their diagnosis and then become advocates for women like them.
We are fortunate enough that one of these women is a friend, colleague, and a fellow advocate, Sonia Mather.
Sonia was a family physician and pregnant with her first child when she was diagnosed at 27. She's a tireless advocate as a co-founder of the PD Avengers and co-chair of the Michael J. Fox Foundation Patient Council. She sits on the board for the Davis Phinney Foundation, the medical boards for the Bryant Grant Foundation and Parkinson Canada. She and her daughters have also written 2 children's books on Parkinson's.
Sonia Mather, welcome back to the podcast.
Thank you so much, guys.
We're very grateful. And what I like is having somebody who's as busy as I am on the podcast so my wife can see that I'm not a weirdo.
Oh, I'll always make time for the both of you.
Now, you are here to help us talk about the different experiences that women have living with Parkinson's, and very especially YOPD women who get pregnant, give birth, and become parents after diagnosis.
Yes, I mean, it's really become more of a focus, an issue that's become more of a focus recently, and I'm not really sure why that is, because it's really been an area of neglect for quite a long time, but it really is becoming sort of more looked at, which I think is a necessary thing.
Sonia, how much do we really know from a research perspective about the experiences of women like you with YOPD?
I wish I could say more than this, but not much, unfortunately. We've always known that the incidence of Parkinson's disease is higher in men than women. And there's always been evidence to suggest that probably estrogen, exposure to estrogen during our lifetime is probably protective in some way against the disease, because women, have a delayed age of onset, and the number of pregnancies and how long those pregnancies, number of pregnancies are important in determining risk. But we don't know enough about it, unfortunately. And I think that's why we're here today.
Yeah, at the World Parkinson Congress in Kyoto, I interviewed Amatola Thomas, and she was really the first woman with YOPD who I had talked with, who shared openly that Sinemet, the 50-plus-year-old gold standard drug for Parkinson's, only worked 3 of 4 weeks of every month because of her cycle. And I was blown away. I think every guy who heard her say it was like, what? That's a thing?
Yeah. No, I know. And Parkinsonism, in some studies, the few that are there, seem to worse for women in the premenstrual period as the estrogen and progesterone levels fall down in general. So maybe the meds are not as effective during that period of time. You'll find a couple of studies that say there isn't a link. So, but anecdotally, speaking with women in the community, I do find that a lot of women experience sort of, a couple of bad weeks every month because of their hormone fluctuations. So it's definitely an issue that women with PD are facing.
Larry and we were fortunate enough to watch a presentation in Kyoto by the Parkinson's Foundation. And in it was fascinating. It was a great presentation. And we learned that women with PD who take the standard doses of Sinemet that they're used to prescribing to men are more susceptible to dyskinesia. Do we know why that is?
Well, you're right, Rebecca. Although men may have more severe motor symptoms, women do seem to develop more levodopa-induced dyskinesia. And women also have a greater response to levodopa compared to men. It might be because of lower body weight or body size. That's a possibility, but it seems to go beyond that. And I think the levodopa just seems to work better in women. It's more bioavailable to women. So it works better, but at the same time, you get the side effects of dyskinesia as well. So that's probably a mixed reason for that.
Well, and probably women are more disciplined in taking their meds on time without protein. Not the same thing about guys, but I know that sometimes I don't follow all the rules all the time.
Yeah, I mean, I'm sure most women are. I'm not one of them, unfortunately, and that's why I tend to, run away with my symptoms. But yes, I think you might be right about that organizational part of things.
And the Parkinson Foundation also found that women often experience larger swings in symptoms than men. Have you found that to be true?
Again, it's pretty much all anecdotal. I mean, this is sort of what we know about women and their symptoms. We seem to have more tremor. Our motor symptoms seem to emerge later. We seem to have a likelihood more to develop falls and postural instability. We have more non-motor symptoms like trouble swallowing and pain, more dyskinesias, as we mentioned, less cognitive issues, which may be why we take our medications on time more so than men, more depression, more osteoporosis, and more changes to the menstrual cycle, obviously, in women, not in men. But, the swings are probably there, but the point is we really don't know. And that's where the question lies.
Is that because women haven't been participating in research or they haven't been invited to research? I'm trying to figure that out.
Yeah, I am as well. I think that, I think it's probably a participation thing, but I also think it's a direction of research. I mean, the questions have to be asked in order for the research to go on. And I think the questions just haven't been asked. That's just been an area that hasn't been looked into enough. I mean, there's lots of women that would love to participate in research that has something to do with their issues specifically. I don't think we'd have a problem recruiting, but I think that we need to find the researchers to do the research.
Now, is it possibly because this is only affecting women who are still menstruating, and the average age of onset of Parkinson's disease is 72 years or older? So we're really talking about, what YOPD is 10 to 15% of Parkinson's. It's like 40% of that.
Right, exactly. We're looking at about 5% of people under the age of 40.
And so I'm guessing pharmaceutical companies aren't seeing that as a viable market.
Possibly. But I think we need to remember that anytime we see a discrepancy, either in a genetic issue or a gender issue, there are answers that lie within that discrepancy, right? So we could be discovering something to do with the pathology of the disease, which might help benefit the whole community as opposed to just the women involved. So I think it's an important thing to do. The other thing is that just knowing about the gender inequality, it can change the management of women on existing therapies as well, if the questions are asked. But you're right about the pharmaceutical reach. It probably doesn't add up in that way.
Well, and it does seem sometimes odd, not from a marketing standpoint or a market standpoint, but most of the research being done will positively affect a large group of people, but the people who are perhaps less affected by the disease. So the people who are having more extreme experiences with the disease, more extreme symptoms, and for longer periods of time are people that seem to be the least addressed, like YOPD and specifically women.
Yeah, no, that's a very good observation. I think that, in general, Parkinson's is more of a blanket term. I think eventually we're going to find that there's a whole spectrum of diseases that are defined as Parkinson's disease. So I think that's going to be teased out eventually.
It does seem, though, that discussion around the topic of women and Parkinson's is increasing in intensity.
Yeah, absolutely. I mean, there seem to be a lot of groups working in this area now, and many are support and educational, like the Davis Spinney Foundation has monthly webinars now. Twitchy Women is another online support group that have regular meetings and educational events. There's a number of online blogs and resources, such as the one started in Spain. And the Women's Parkinson's Project is another one, which will be starting up soon. The Parkinson's Foundation has created a national agenda to identify research and care practices that better capture the needs of women. WPC is working towards that as well. And so just to put, that into perspective, the PD Avengers, we're going to have a women in PD working group that's sort of going to bring all the collaborators together, as well as opening up communication between the community and the researchers to get, an idea of what questions need to be addressed and what areas need to be addressed. So to try and bring all those groups together to work as one instead of in their individual silos to help address these questions.
Well, that's exciting. I mean, it is an area that needs to be explored more and has been ignored. And I think from the last WPC till now, groups like the PD Avengers and Twitchy Women and really with the Parkinson's Foundation's presentation at that last WPC, it kind of launched this, curiosity. I think now there's a curiosity and an intrigue around it. And it's sort of, it's the hot top. It's one of the hot topics right now in Parkinson's.
Absolutely. Yes.
I think it's a good time to introduce another person into this conversation. Larry, our friends at Parkinson Canada connected you to Caitlin Nagy.
Hi, Caitlin.
Hi, Larry. How are you?
I'm good. How are you doing?
Good. Nice to meet you.
Nice to meet you too. Caitlin is a 38-year-old mother, married, living in Toronto, who was diagnosed 7 years ago. She's been hiding it from her friends, family, coworkers until now. This is Parkinson's Awareness Month, and she is prominently featured telling her PD story in the Parkinson Canada No Matter What campaign. You take a listen. She's the first voice you'll hear, and she's heard several times throughout. It's just 45 seconds.
Nothing prepares you for Parkinson's.
Nothing.
But no matter what they say,
Life goes on.
no matter what,
No matter what.
no matter what,
No matter what.
No matter what.
So I made a choice to make a difference.
Because there is strength in numbers.
there is hope in research
And there is support.
all around me.
I want you to know I will never give up.
I will always be there.
I couldn't do it alone.
I'm going to say it loud and proud.
Parkinson's matters.
I'm here
I am here.
I'm here.
I'm here,
I'm here.
trying my best.
And I won't give up.
no matter what.
That's a pretty cool campaign.
Very.
Simple and powerful.
We started our conversation at the very beginning, which I like to do, which is the search for a diagnosis.
6 months after I saw the original neurologist, I went to see a doctor at Toronto Western. And it was interesting because I think there was a bit of a miscommunication between my doctor and her doctor, because it sounded like she thought that I already knew that I had a Parkinsonism, but I didn't. So she said, so it's definitely Parkinson's or Parkinsonism, but I want to do some genetic testing. And I was kind of like, what? No, I don't think so. That's not right. I'm super stubborn and super determined. So I was like, I'm going to prove you wrong. So I spent the next 5 years trying to prove her wrong.
So did you win?
I'm still working on it. I'm going to win.
Sonia, we hear stories all the time about doctors struggling to diagnose women with Parkinson's. It takes longer. There are a lot of misdiagnoses. Why do we think that is?
Rebecca, that's a great question. I think diagnosis of Parkinson's disease in general is difficult, right? Because it's only based on clinical judgment and, filling out some forms and kind of looking at the scale. So in general, it's a difficult diagnosis. And then when you put on top of it that a lot of people can present with non-motor stuff first, like depression and sleep disorder and that sort of thing, that makes it even more complicated, because I hate to say it, but a lot of time women are dismissed when they come in with these concerns as non-sort of specific, things that are going on in their life and the way they're feeling, and kind of more dismissed as being in your head kind of situation, which is, not good. And as women, I think we're I'm more likely to advocate strongly or push strongly when it comes to our loved ones. We're sort of tend to be last on our list. So I don't think we advocate as strongly for ourselves as well. So I think it's a matter of the non-specific nature of most of our presentations, and also the fact that, in general, I think we need to be louder in terms of letting our physicians know that, it's not in my head. I'm really, noticing these things.
A lot of people talk about how when they are given their actual diagnosis, oftentimes it comes with this cold bedside manner of this sort of matter of fact, here you go, you've got Parkinson's, on your way, here's some Sinemet. And is that changing?
Yeah, I do think it is. I do think that the medical community is moving more towards patient-centered care as opposed to the kind of paternalistic model that we had before. But I can see from both sides, being a physician and a patient. And what I often tell my physician colleagues is that, and my husband, who's a surgeon, he's very good at his bedside manner, thankfully. But, it's the fact that for your physician, for instance, that's probably the 1,000th time they're telling someone they have a diagnosis of Parkinson's. But what they forget is that's the first time the patient's hearing it.
Right.
So you're on very different situations. And so I do think, though, that that's starting to change now as we're developing more skills in terms of patient-centered care and looking at patients' quality of life.
Well, and do doctors rank diseases? And so because it's Parkinson's, it's like, well, it's relief because it's not something worse. And so,
yeah. I think that was sort of, people say, well, you have Parkinson's, at least it's not blank.
Right.
And that's, somewhat understandable from a physician's point of view, because you're not dealing with something, acute that needs immediate attention, and you're looking at mortality of your patient. And, those can be obviously more anxiety provoking for the physician as well, or more dire for the physician as well. But yeah, I do think there is, some of that involved as well.
Well, because when you start talking about the nervous system and something's not working right in your brain, everybody goes to brain tumor, everybody goes to all kinds of crazy things, right? So it does feel, and we experienced that as well. It's like, oh, it's Parkinson's. It's not a brain tumor. It's not this or that, all these other things that they had mentioned. Meanwhile, we had no idea what that meant until we asked questions and started doing our own research. That perspective wasn't really offered by the doctor, but that does seem to be improving because awareness seems to be improving. And I know that there are now training programs that people are doing in hospitals to make sure that people, for instance, in ER centers and whatnot, have a better understanding of Parkinson's and how it may present when people come in.
Exactly. And I think patients are also learning to advocate for themselves and not to be necessarily complacent or satisfied with an answer that they don't feel helpful.
Let's listen in again to Larry and Kaylin.
Let's talk about the pregnancy. What happened? I mean, I know how you got pregnant. I mean, I don't know exactly how you got. Yeah, we have to start there.
No. So I did get pregnant, and it's such a great experience. We had been trying for a while, and things weren't happening. And I think it was the fall of 2018, and I thought, okay, if we're not going to try, then I've kind of reached the point of maybe I should try medication. My husband and I said, okay, if we're not pregnant by January of 2019, let's try the medication. So Christmas Day, we found out that I was pregnant.
Wow, that's awesome. And then how did the pregnancy go with Parkinson's?
The pregnancy was really difficult. It was, I'm going to get a little bit feminine for you for a second, just give you some way too much TMI.
That's what people need to hear.
Yeah. Just a bit of background. So with my condition, every time I cycle through a menstrual cycle, my symptoms change. So as soon as I menstruate, the symptoms completely drop, almost to a level 2. I was saying 1 out of 10, 2 being totally manageable. I'm shaking a little bit of my left hand, but I can move around. I've got lots of energy. And typing and writing is a little bit difficult, but it's manageable. And then I would say, as soon as I'm done ovulating, so on cycle day 14, it totally switches. I know what day it is because I'm oh, cycle day 14. Here we go. So then it just gets into slowly progressing worse and worse and worse until around 3 days before I menstruate, it's just to the point where like I have to be on the couch. I can't do anything. Everything, my whole body is shaking. My rigidity and my motor skills are just completely gone. Unfortunately, what happened was when I got pregnant, those hormones must have been related to pregnancy. It was like being on the last 3 days of my cycle for the entire pregnancy.
Oh, no.
Yeah. Yeah.
Pregnancy to begin with and giving birth is such a painful and magical ordeal.
Yeah.
This had to have just been like times 10.
Yeah. Yeah. It was so bad. Like, I was like, I don't like, what if it doesn't get better? Like, I was just absolutely terrified. And terrified of also being a new mom and not knowing what to do. And like, also having like these panic attacks of how am I going to nurse my daughter? How am I going to change her diaper or pick her up or walk her down the stairs when I can't even get across the room? You
had a lot of mind movies going. Like,
yeah.
There's like horror films just going through your head.
Yeah. Yeah.
How did you get past that?
I had to focus on her, and I had to focus on this really special being that was inside me that wanted to come through and making sure that she was going to be okay. And that was really my guiding light, was that I was bringing a beautiful human into this world, and I needed to make sure that she was going to be okay.
I have to believe though that there were moments where you're like, is this worth it?
Oh yeah. Yeah. Like I had, to be honest with you, I had so many dark moments where I was like, I can't do this. I don't want to do this anymore. I had to definitely see a therapist because I was having super dark thoughts about wanting to end my life because I thought it would just be easier for everybody else. My husband was so supportive. My close friends were so supportive. But it was hard because nobody else around me was going through it but me. So that was really scary.
At that point, had you accepted that you had Parkinson's?
No. I didn't accept that I had Parkinson's until the meds started working, until I took medication 3 months after my daughter was born and it started working. I was like, oh, yeah.
And what was the first time taking, guessing levodopa?
Yeah.
What was that like?
So it actually didn't work for the first month or so because I was taking protein with it and I just thought, I'm supposed to eat with it.
Oh, did they forget to tell you about that?
Yes. They're like, you're supposed to eat with it. But I didn't know that I wasn't supposed to have protein with it. So that was interesting. Where I was like, this isn't working. I don't have it. I told you. But when it's that, I remember the first day it started working, I had a whole dance party by myself in my office, huge dance party for about like 3 hours. I'm like, this is amazing.
This is amazing. Amazing, right?
I'm really curious, Sonia, what your reaction is to her story.
I mean, I feel a lot for her. I've been through it 3 times as well since my diagnosis. I was actually pregnant with my first when I was diagnosed with Parkinson's disease. And it's interesting because much like all our stories with Parkinson's disease are unique, so are all the women's stories that I hear about their pregnancies. They seem to be unique as well. But it does show, it kind of highlights a couple of things. One is that about 50% of women report that their pregnancies, they feel worse during their pregnancies with regards to their Parkinson's symptoms. And then majority will get better after the pregnancy, but some kind of keep on getting worse, like that they'll sort of stabilize at a worse state afterwards. So that feeling of going downhill during a pregnancy is actually fairly common in women. Not taking medications is actually another very common occurrence because a lot of women probably get worse during the pregnancies because they stop Parkinson's medications because they're worried about the effects on the fetus. And our metabolism probably changes when we're pregnant. So that, might affect our drugs and also the stress of being pregnant can also worsen the symptoms as well. So, her story kind of illustrates a few of those issues.
What were your pregnancies like?
Mine were, I guess, mine weren't too bad. I mean, I had the regular nausea and stuff that a lot of women who don't have PD also get. I was on no medications for the first. Actually, I don't think I took medications for all three, but you have to understand that the understanding of PD and pregnancy was even less 22 years ago. My kids are 22, 20, and 16. So when I was going through it, it was a lot less. What I found interesting about my pregnancies is that the response of the physicians. So my first pregnancy, I was just, followed at a normal interval and no one was there except the obstetrician for my first pregnancy. My second pregnancy, everyone was there, the neonatologist, the specialist, everyone was gathered around saying, oh my God, this woman with Parkinson's is delivering. And then the third one, we're back to, she's delivering, we'll have the obstetrician there. So it's very interesting in terms of how the physician, because they didn't know, they just don't know what to expect. So reactions can be different depending on who's involved.
And were there any issues? They were the 9 months labor.
Yes. And that is something we do know. We do know that there doesn't seem to be any difficulty getting pregnant if you have Parkinson's. So fertility issues don't seem to be a problem. And the pregnancy itself, in terms of duration of pregnancy, doesn't seem to, have any effect on those sorts of things, nor does it seem to have any effects on the fetus per se.
She talked about how it didn't work for her. The Sinemet didn't work for her for the first month because no one told her not to take it with protein.
Right.
It seems to be a lot of little tricks and tips that don't get passed along until you have a group of friends with Parkinson's who can help you through this.
Yeah, we learn a lot from each other. That's for sure.
Because it wasn't really until I had met everybody in person at the WPC when my Twitter feed came to life in front of me, and we became, we started talking to each other, where we shared experiences and how to get through certain things. And it's like, I'm like, oh my gosh, there's a whole resource of information out here that the doctors and the nurses and the neurologists and the movement disorder specialists, I don't even know if they're aware of all the things that we're doing to manage hour to hour.
Absolutely. I mean, I think most of them, the management tips that I've learned that have worked for me have been through other patients with Parkinson's. And I think the medical community needs to be informed about some of them.
Did you have anybody you could turn to and ask questions when you were pregnant with Parkinson's?
No. No.
Challenging.
Yeah, it was challenging. And that was because initially, for the first 10 years of my diagnosis, I really didn't become involved with the Parkinson's community. I had kind of decided I didn't really want to deal with my Parkinson's. So I kind of buried myself in work and other social engagements and family. So, so no, I didn't, unfortunately. But there are more resources available now. I mean, now that we have the advent of Facebook and online support systems, it's a lot better for women.
Getting back to Caitlin's story, immediately after she delivered the baby, she was anticipating some relief.
Mm-hmm. And yes, that did happen with medication, but not until 6 months later. So I thought pregnancy was bad, but add in postpartum depression on top of what you're going through. And then every time I would nurse, I would go through this, my whole body would seize and I wouldn't be able to lift her up after nursing. It was the oxytocin. I don't know what type of hormone does it, but I couldn't move. I couldn't walk across the room. I would literally fall over if I wasn't holding on to anything. So my mother-in-law, being a great labor and delivery nurse, was like, you've got to stop nursing. This is just too hard on your body. You can't do it. So that was really hard for me. I stopped nursing my daughter at 6 weeks. So I know that she got a lot of the good colostrum and everything, but it was hard because I felt like I was failing as a parent and that I couldn't do it. If she would get up and cry in the night, my husband had to come in and help me and hold her, get her propped up on me so that I could nurse her. It was just so tricky. Even walking down the stairs, somebody had to carry her down the stairs for me to get down the stairs. So I went through a lot of emotions of feeling completely useless and kind of feeling very disconnected from her because I felt like I wasn't doing my job right.
I think there's a lot of people with Parkinson's who can relate to feeling like a failed parent. I feel like I let down my son every day.
Yeah.
And I don't know how to get past that.
Yeah.
Now, I do know that he doesn't know anything different. I'm his dad. And he loves me because I'm his dad.
Yeah.
Bridget loves you because you're her mom, and she doesn't know any different.
Yeah.
But psychologically, we had parents and we know what they did for us.
Yeah. Yeah.
And it's hard not to go, but.
Yeah.
So what do you do to help you get through those moments?
I definitely have to be okay with the fact that when I'm having a really difficult time, like when my meds are kicking in, I'm going through that dyskinesia hit. I have to ask for help, and I have to time my day around, getting my daughter up and making sure that I can spend time with her and I'm in a good spot and get her off to school. And I have to be okay with, if I'm walking up to the school, or not school, but daycare, if I'm dropping her off at daycare and I'm having a huge twitch or freaking out, I need to be okay with saying to, the assistants, hey, can you help me? I need some help. And I know that she doesn't know any different, but I'm so terrified. I'm so terrified for her. Like, what are her friends going to say? Like, what's wrong with your mom? Or, some of the other parents looking at me like I'm twitching all about and I look drunk or something like that. It's so humiliating and really difficult, but I have to focus on the acceptance, knowing that I have it, and being comfortable with explaining to people that I have it. Because what I've noticed in being able to do that is all of a sudden there's empathy, right? And empathy comes with support and understanding. And I have to be okay with asking for help and being honest with admitting with what I've got. In the beginning, I was so angry and annoyed with people that would ask if I was okay, because it just felt like they were taking away my independence. But I needed to be okay with saying that I need help and asking.
Oh, it sounds like you've had a good counselor.
I worked on it. I've worked on it. Yeah. Definitely invested the money there.
Yes. What can you say to care partners, or partners in Parkinson's, as my wife and I like to call it, on how they can help? It's such a tricky situation of trying not to smother and trying to be helpful, and I can't take away your pain.
Yeah, I think my husband did a great job. He was really amazing through the whole thing. He, I think he was really, really good at just if I needed to have a big cry, he just let me cry. He was just totally supportive. And, he would consistently acknowledge, I can't understand what you're going through, but I'm here with you. I support you. He was totally my target. If I needed to get mad, he would just say, okay, where is this coming from? And we'd be able to talk it through. Also, foot rubs are really nice. I would definitely emphasize the foot rubs.
Excellent. Do you find you have a shorter temper still?
No, I would say that I'm much better. I used to, even before Parkinson's, I was a little spiteful. I would say that this has definitely taught me to really look within and kind of acknowledge what I'm going through. And that's really also helped with anxiety as well. I'm able to go, okay, whoa, I'm feeling anxious. Why am I feeling anxious? There's nothing wrong. Nothing's wrong that's happening. I'm feeling anxious because, it's the end of the day. And I'm it's allowing me to really question why I'm feeling certain ways and really step back and look at it from above versus within. I don't know if that makes sense.
Yeah. That's awesome. So how many years since diagnosis now?
I think it's 7 years. 7 years. I'm 38 now.
Okay. So 7 years since diagnosis, and how many years since acceptance?
I would say or 6 months.
And here you are talking about it. That's awesome.
Yeah.
Thank you. I mean, that's sharing your story is the most powerful advocacy you can do. If we don't share our stories, we'll never raise enough attention to raise enough money to do enough research to cure it.
Yeah, I know. And my husband was kind of asking me, like, you're getting so involved in this, like, you should we have enough time for this? And I said, like, I've been tackling this situation, these symptoms, this disease for over, like almost a decade, 7 years. And instead of me putting energy into like trying to figure out what's wrong, I'm taking my energy and putting it into this and trying to create more of a platform for everybody to be able to come forward and talk about it and invest in coming up with a way to solve this.
I think a lot of care partners ask, are you sure you have enough time for this? Does it sound familiar, Rebecca?
Quite. Yeah.
Sonia, I'm guessing Aaron says that to you too.
All the time. He's very good. He's very supportive.
Why do we do so much?
For me, the worst thing would be to be idle and not engaged, not focused on something. If I was too focused on myself, I think I'd drive myself crazy. Right?
Yeah. No, I hear you. I mean, for me, it's the first time. I used to think that radio was my purpose. And then now I realize my purpose is I learned how to do great radio so I could tell people about Parkinson's.
That's exactly it. I mean, for the first couple of years after I stopped my clinical practice, I really, really missed it because I couldn't see how I was going to use those skills. But, it really has helped me transition into this sort of Parkinson's world and hopefully bring some of those skills into the work I do now. So it's truly been my life purpose. I agree with you.
And sharing your stories in the way that Caitlin is in a vulnerable way, and both of you have as well. You're right, honey. It's so powerful. That is the easiest way to affect people on multiple levels and really supercharge them for advocacy, and then encouraging and kind of giving permission for other people to tell their story as well. Just opens all of that up, and there's nothing but good that can come from that.
Exactly. Yeah.
She mentioned that she found it difficult and had to learn how to ask for help. And I know that experience. I'm guessing you do too, Sonia. Why do you think it's so hard at first to ask people for help?
I've given a lot of thought because I still have a hard time asking for help. And it's probably been to my downfall in some ways, but for me, it's almost been a coping mechanism in some ways, because that stubbornness, I feel, has kind of got me through the last 22 years in some way, shape, or form. But I think the problem with this disease is that, like my husband used to say, oh, I can't wait to retire. You're lucky you don't have to do it. You can follow what you want to do in terms of your life purpose. But for me, it's like, oh, I didn't have a choice. And that lack of choice is what the issue is. It's not that I had to stop working, but if I'd chosen to stop, that was different. But this disease chose for me. And that was a difficult part. So just like, asking for help. If I can't open a pickle jar, I'm not asking for help because I can't open the pickle jar. I don't want to have to ask for help. So I think that kind of, acceptance is a difficult one. And although obviously I accepted my disease, it took about 10 years, but I did. That acceptance of having to ask for help, which, is part of this, has been difficult still for me.
When it's so difficult for us to ask for help, and Rebecca, I'd like to hear from the care partner perspective of, it's probably hard for you to see a struggle and know when to step in.
During Caitlin's story, I definitely identified with her husband in that situation where she was acknowledging that he struggled a little bit and seemed to find some sort of balance of when to intervene and when to offer help and when to let you struggle a little bit. And that's something that is a constant negotiation as a care partner. And relearning and unlearning how to communicate in that way about help. And when I need to step in and offer help because it looked like you were struggling to, it's a challenging balance for sure. And I can imagine that during a pregnancy, when you're thinking about your whole family in this being, right? And just kind of facing the additional stress of impending parenthood, that would be, that would ratchet everything everything up a bit. The other aspect that I want to acknowledge on that too is that care partners often have a lot of empathy for the person with Parkinson's struggling to ask for help, because we're in a situation too where it's difficult to ask for help because we're in some ways the person who's supposed to be in charge, or the person who has things covered and is aware of all the details and juggling and, spinning the plates. So us asking for help, because we're the ones who you would come to for help, most likely, at least the first level of help, that is a struggle as well, because we're not supposed to need help, right? Your ego tells you we're the ones in charge. We're the ones who have a fully functioning brain and can kind of manage all of these things, and that's our job, and we embrace it. And then you get to those days where you're like, I just can't do it on my own. I have to have help, and that's a barrier to cross, and one that I know I struggle with, and I know a lot of care partners struggle with that.
And as with everybody with Parkinson's, if you've met one person who is YOPD who has given birth, you've met one person with YOPD who has given birth. Every experience is unique. And before we, go, I want to introduce you to one more person, Paola Celli. Paola was born in Ecuador and diagnosed at the age of 12. She has since moved to the U.S. And at some point, she had asked her doctor early on about the ability to get pregnant and to give birth.
When my doctor in Ecuador, when I got married, before I was getting married, I asked my doctor if I could have family, to have babies. And he said no. So when I got married, we decided to go to the doctor here in Texas and ask him if I could be pregnant. And he said, yeah, you can do everything. You just have to let me know, and we can decrease your medication, and you will be all right. So apart from the amantadine, I take out the amantadine, and I was in the same doses of Cinemed and Mirapex, and my pregnancy was perfect. I mean, if you read a What to Expect book, and you said, this is going to happen to you this day, that was happening to me. It was a really good I was considered a high-risk pregnancy, but because of my Parkinson's. But apart from that, it was perfect. Even I didn't feel dyskinetic or bradyskinetic. I think the hormones levels, the change of the hormones helped me a lot. At the end of the pregnancy, I started having panic attacks because it was starting to close to the due date. But apart from that, it was perfect pregnancy. And when the day my son was born, I didn't take the medication for 2 days.
Was it you just high on dopamine?
I don't know. I think maybe because the hormone levels were, it helped. I don't know. After the hormones came back to their own regular level, I started taking medicine again.
Have you ever heard that, Sonia, where somebody has so much hormones flowing at the right levels after pregnancy that they don't need their medicine for 2 days?
Well, no, I haven't heard that before, but it's very interesting. I'm just trying to picture what the hormones are doing during those first postpartum days that would cause that. But the one thing I couldn't quite make out what medication she was taking during pregnancy.
Cinemed and Mirapex?
Okay. I mean, we know that levodopa is pretty safe during pregnancy because that's been the one that's most extensively been studied and documented. But other dopamine agonists and MAOB inhibitors and that sort of thing, we don't have really sufficient data.
They took her off amantadine.
Yeah, amantadine has evidence of potential to harm to the fetus, and that's definitely not recommended during pregnancy. But it is possible to take levodopa for sure. Consult with your doctor first.
and then the fact that the doctor in Ecuador was like, oh, no, you can't get pregnant. It goes to the idea, and this is a PD Avengers thing, we need to get the information about Parkinson's into the right hands around the world.
Absolutely. Yeah, absolutely.
It's a big problem.
It is. It is. Absolutely.
Well, and I've got to imagine that it's even worse for women, and women, especially women who are pregnant. Again, a really small percentage of people with PD. And so if there isn't a lot of information here in North America, then in other countries, it's got to be very challenging.
Paula's kids are now 8 and 12, and she's been living with PD for over a quarter century. She's nearly 40, and Parkinson's is really taking hold. She talked about how sometimes she and her kids have to reverse their roles, and they end up helping her.
Lately, I start when I have stiffness, I cannot walk, so I have to throw myself to the ground and start like crawling or doing like a snake to try to get one place to another. It takes me like ages from here to the wall. Because I cannot walk.
Wait, let's back up. When you stiffen up, you have to get on the floor and snake to where you want to go.
Yeah.
And how long would it take you to get from where you are to another room?
Like, that's why I don't do it. You see my muscles? That's because I try to do everything with my arms, but not because I'm doing push-ups or I'm doing anything. So it takes me like what a regular person would take, let's say 1 second. It will take me like 20 minutes.
Oh my gosh. What do your kids think of that?
The day after, before yesterday, I was feeling, because here it's really hot right now, so I didn't know I was dehydrated. I need a lot of water. So I felt really stiff, and my husband was downstairs, and I was just crying because it really hurts. And my son says, "Why are you crying?" They know already. But, "Mom, are you okay?" And I said, "Yes." "Why are you crying?" And I said, "Because I felt useless." And I said, "We are here for you, Mom. You don't need to feel useless. We can help you and anything." So I feel that they help me, but I feel like I need to be good for them because they're still little. But I think they didn't show me that they were worried. But when they left me in my room, they went back up to their room and they started crying. And my other son came back and said, "Are you okay, Mom?" Elias went, my younger son. Elias came up crying. And I said, "Why?" And she said, "Because you are crying." So I know they realize I'm going to be every day worse. So they suffer.
That's tough. And so that's the problem with this damn disease, is that it's degenerative. And so even if the pregnancy is perfect, it doesn't mean that motherhood's going to be easy go.
No, that's absolutely true. And I think, Parkinson's isn't just our disease, it's a family disease. It affects the whole family unit, particularly those that are most vulnerable, which are our kids, really.
When your kids are now grown and, they don't know you any different than having Parkinson's, but how do you think it impacted them?
I've often thought about this through the last 22 years since the birth of my first. And I was really scared initially because I thought, I don't want them to have to deal with the stress of just regular stress that you experience during childhood and adolescence, and then add me into the mix on top of that and cause them more stress. I mean, I feel like as a parent, my duty was to provide them less stress and make life easier for them. So I was really worried about that. But what I did notice, and I still notice today, is that this whole experience has taught them a lot. Every moment can be a teaching or learning experience. And it's taught them empathy. It's taught them compassion. It's taught them the importance of charity. But most importantly, it's taught them that life isn't perfect. And, you have to be willing and able to face the challenges that life brings. And that's really what's going to define you, is your ability to persevere and succeed despite the challenges. And so, in that way, it's been a blessing in some ways. I think they've really learned from it. And a lot depends on how you approach it as a parent as well. And you have to be comfortable with it yourself. You have to come to a level of acceptance yourself before you can impart that to your kids.
What an amazing lesson in resilience so early in life, right? Watching you as a great model, and our son watching Larry and us being really vulnerable about that. I with all of the doubt and fears that I have about it, you're absolutely right. Like, we're just in the very first stages of it. It just seems like such an amazing, intense, but really important lesson that will benefit them to have that resilience and understand what challenges can be presented in even the most extreme cases, and move forward and make a positive effect on the world. You guys are great models in that way.
And so are our partners.
Yeah. I agree. And I think both these women, Caitlin and Paula, are showing tremendous strength. I mean, Caitlin has hidden her diagnosis for 7 years, and Paula has not shared her stories for over 25 years. And now they're doing the PD community a great service by sharing their stories. And Paula told me that she wanted to speak up now so she can help other teens with PD. Now, think about that. Like, I know, like, Matt Eagles was diagnosed at 8. There's a friend of mine named Hillary who was diagnosed at 11. And so it happens. That's called an adolescent onset. Is that correct?
That's right.
Yeah. And so she wants to help other teens with AOPD and wants more research into what's happening with women who have PD. And she believes the secret to solving PD may be hidden in hormones.
In my deep end soul, I believe that there is a way that hormones, because first of all, every monthly, when I have my monthly hormones change, the symptoms get really worse. So I believe that maybe there's a way to treat with hormones. Because as I said, when I got birth to my sons, I didn't take the medication for 2 days, complete anything. And I thought, well, this having given birth to a baby, it's a miracle. It changed my life and get rid of Parkinson. But I think everyone needs to know that maybe it's a possible treatment with hormones, or maybe it's a cure. Because you never know. When I have my monthly cycle, I feel the worst. That's when I cannot do anything. I'm a woman right now, but I don't want to end like an old woman without trying to do anything. Because I was a teenager, then a young woman, and I'm almost 40. So soon I'm going to be an older woman, and nobody will take attention what I have had over my life. So I think it's important to people to know that Parkinson's also can be diagnosed in young people, that maybe the progression is slow, but at the end it's the same progression. So they can do something about it, and it could be research in that kind of people. I don't know.
There is growing interest in the research community of exploring, especially the disease-modifying effects of estrogen, but we're really still far away from actually understanding what underlies the differences between men and women. The areas of uncertainty go from what role does estrogen play and why are there gender differences? What are the gender differences exactly in symptoms and presentation? Why we respond differently to medication? The problem is the studies so far have really had small samples and lacked good quality randomized controlled trials, sort of the gold standard of especially in terms of medication differences. And we've also relied a lot on retrospective data, so patient recalling their symptoms and experiences instead of prospective data where we're studying a cohort as they move along. So, it's growing and we need it. We need especially a large prospective trial, and that's starting to happen. So we're getting there. We're just not there yet.
Well, thanks so much for being here with us today. It's really a treat to talk to you.
Oh, it's my pleasure.
And thank you for all the advocacy work that you're doing.
Thank you. Same to you.
This is When Life Gives You Parkinson's, a Curious Cast podcast Our story producer is Dila Velazquez. Sound design by Rob Johnston.
The presenting partner is Parkinson Canada. Diagnosed with Parkinson's? You are not alone. Parkinson.ca. And be sure to check out their No Matter What campaign for April Parkinson's Awareness Month.
Thanks also to our promotional partners. PD Avengers, a global alliance of people with Parkinson's, are partners and friends standing together to demand change in how the disease is seen and treated. Join us now at pdavengers.com. We are sending red letters to the White House asking the UN to recognize World Parkinson Day and developing working committees on many of the PD topics that need addressed, including women and PD.
The Michael J. Fox Foundation Parkinson's podcast, hosted by Larry Gifford. Available on Apple Podcasts and at michaeljfox.org.
He's a pretty good podcast.
Yeah, he does okay.
Yeah, he can't even talk right now. Spotlight YOPD, the only organization in the world with the singular focus of raising awareness of young onset Parkinson's disease. You can find them at spotlightyopd.org.
And the World Parkinson Congress 2022 in Barcelona, Spain.
Woohoo!
And the 2021 WPC Virtual. It's in May, everybody. Access amazing talks, including Larry's on how to have a work-life balance.
Don't laugh.
We learn through our challenges.
Yes.
Go to WPC2022.org for details. Tickets are only $25. Register today.
And thank you, and you for listening. Please take a moment to subscribe to the podcast at Apple Podcasts, Spotify, CastBox, or wherever you listen to the podcast. When you subscribe, and it's free, it just comes straight into your phone or right into your computer. So you don't even have to think about downloading it. It's just there when you wake up in the morning. And also, while you're there, subscribing, give the show like a 5-star rating, and then when you comment, say nice things about us.
You can also engage with us on social media. It's at Parkinson's Pod on Facebook, Twitter, and Instagram, or email us at parkinsonspod@curiouscast.ca.
And since it's Parkinson's Awareness Month, I recommend that you email everybody in your email address a link to the podcast. They will not be annoyed at all.
I don't know how to respond to that.
Just tell them it's World Parkinson.
Larry told me to do this.
Yeah.
It's all his fault.
It's not spam. It's a podcast.
Keep positive.
Keep exercising.
Keep listening.
We'll talk to you next time.
Canada may be known for its landscapes and friendly people, but beneath the surface lies a darker side of crime, history, and the paranormal. Since 2017, the award-winning Dark Poutine podcast has explored the shadowy corners of the Great White North and beyond, delivering chilling tales from a uniquely Canadian perspective. Hosted by Mike Brown and Matthew Stockton with over 300 episodes and fresh releases every Monday, Dark Poutine is your weekly ticket to the creepier side of Canada. Listen to Dark Poutine on Apple, Spotify, Amazon Music, or wherever you get your podcasts.